Oh man, there's a long line. So I just got to Starbucks. So this morning I tried to record a get ready with me.
And oh my god, my face is so like give me moisture. Give me moisture. Alright, let's go get moisture. I'm done with this muscle of a heart.
And I don't know if I'm gonna post it or not. I mean, if you guys obviously saw it before this video went up, but basically my camera sucks, and so I'm using this old memory card that I used to use. It has like barely any memory, so every single time I was recording, you know, to try to do my makeup and stuff, like it would stop recording and it doesn't tell me when it stops recording. So I was literally doing my makeup, talking to myself for like 20 minutes, and then I look at it, like I got up halfway because I'm like, I bet you the camera's off, or I bet you it stopped recording, because I just know my camera. And I got up and it did stop recording. So I'll tell you guys what I wanted to tell you guys. So basically I have an interview for to be a patient care tech at a children's hospital. So I applied last week and I got a call. So my interview is going to be next Monday, and I am so excited. So
Starbucks, what can I get started for you today?
hi, can I get a grande iced caramel macchiato?
What else for you?
And then can I get the reduced fat turkey bacon sandwich?
Okay. Anything else?
That'd be all.
Okay. Your total's gonna be at $9.20.
Thank you. I did get hired, or I didn't get hired. I got an interview to be a patient care tech at a children's hospital, and it's not a children's hospital. It's actually like really close to me. It's about 45 minutes away from me, but it's going to be a PRN shift, so it's going to be an as needed. So basically we're going to have a computer system, and every week I only have to work 1 day a week, and I can pick what day I want to work. So I can pick up shifts that like people don't want, and I can work either once or twice or whatever, however many times I want, but it needs to be at least 1 time a week. So I'm really excited. The pay is pretty good, and I'm just so ready to start working again. I haven't been working since last December, so it's been about 10 months since I've worked. And then on top of that, I am getting a lot of experience in the peds department, so I'm super excited because I do want to get some experience so that when I do graduate, I can hopefully get hired there as a nurse. Because they say, I don't know how true this is, but a lot of the hospitals that I've been doing my clinicals at, I love to talk to the nurses about, you know, what I want to do and the recommendations and blah blah blah. And they've been saying that it's really hard to get into peds as an RN. So maybe if I'm already working at the hospital, it'll be easier for me to transition into the children's hospital because I will have experience. So it's kind of my train of thoughts. But we will see. I'll update you guys on whether I get the job or not, but I have high hopes, and I know that I'll get it because I know this is for me, and yeah. Hello. Thank you.
You need a receipt today?
No, that's okay. Thank you. Thank you. Same to you. Alrighty. I'm so excited. Some coffee. And then I have to jump on the highway, which I got this new mount because I wanted to drive and talk to you guys, but it's not very sturdy, and I haven't figured out how to make it sturdy yet because I just put it together today. But once I figure that out, look, it's already shaking, and I'm not even on the highway, and the highways are but yeah, so I'll check in with you guys when I get to school. And then later on today, I kind of want to show you guys how, you know, what some of our clinical assignments look like and what assignment we have due on Saturday. So I'll check in with you guys in a little bit. I'm going to eat my sandwich and have me some coffee. So I just got to school. I feel like I say that every time I get to school. I just got to So I kind of wanted to show you guys what I'm going to be working on and why I got here so early and all that. Well, this is what we have. So I wish I had an empty one, but I actually gave it away to my friend yesterday, so I don't have an empty one right now, but I could show you guys an empty one if you really care. So this is what we have. So this is an SBAR. So that's what it looks like. Right now there's some patient info on there, but don't worry, there's no names, there's no date of births. There's nothing that's HIPAA that I get in trouble for or anything. But so this is what we do every time we go into clinical. We bring this, and then this is what we have to complete. So if you don't know what an SBAR is, it's basically a way to sum up everything about a patient. And the first part of it, in the S, you're literally gonna look up their gender, the patient, the admin date, their code status, and you look up their allergies, their diet, activity, labs, diagnostics, medications. So that's what the situation is going to be. So why are they here? And what's their most important information? So, and then the B is background. So past medical history and their surgical procedures. And then A says, oh, A is assessment. That's what it is. A is assessment. So it's going to be their vital signs. You want to take vital signs. On here, you only need to take them 3 times a day, 3 times during the 12 hours. And then you're looking at their neural status, psychological, sensory, respirations, cardiovascular. Obviously, you're going to listen to their heart, their lungs. See what I write? I think that's all in there if you kind of want to. You know, you do GI, GU, IV site safety. So this is all the things that we're kind of looking at. After that, we're going to come up with nursing. I didn't fill this out just because this is what I'm going to do for my my clinical, my concept map. So I need to write this all way more in detail than in this little box, so I didn't even bother. But I do have some ideas of what I'm going to make as his nursing diagnosis and stuff. So that's what you're going to do. You have nursing diagnosis, your goals, your interventions, and then your evaluation. And then the last page is going to be your documentation. So basically what you do with what you did with the patient the entire day. So you know how nurses do hourly roundings? Well, every time you go in to do an hourly rounding, you're assessing, you know, pain, you're assessing how they're doing and all that, and like you just write down everything that you do with the patient. So, you know, like for example, at 7 o'clock, you know, we get to the hospital around 6:15, but at 7 o'clock everybody starts waking up. So at 7 o'clock, you know, I say check patient status from night before, no pain at this time. So when I introduce myself, they don't care if you introduce yourself. You're not going to write that in the chart, but you do want to make sure that you write that you checked the patient status to see how they were doing from the night before. And then, yeah, so just every hour you kind of write down. This isn't as detailed as when I'm going to write it down, because I still remember, you know, more in depth of what I did, but this is a summary just so I can remind myself of things that I did. So yeah, this is the SBAR. And then so this is what we do every clinical day, but for our concept map, we actually have to do a full care plan. Well, it's kind of like a care plan, not entirely, but a care plan. So it's going to include, so on here, I can show you guys like the labs and stuff. You just write them down. I don't know if you could see where it says pertinent labs right up top. So that's all that you put. You just put a little summary of them. But in the concept map, you're actually going to write down all their labs. So you're going to write down literally their CBC, their chemistry, their hepatic function. And they're not always going to have all of these labs for all the patients. But the ones that they do have, you want to make sure to write those down. And then if they're high or low, like as you can see here, the ones that were high or low, I highlighted them just so I can remember that those are the ones that are abnormal. And then you need to explain why they're abnormal. So my patient came in because he had an upper GI bleed. So he came in with a lot of generalized weakness. And that's obviously due to his blood loss. So his RBCs, his hemoglobin, his hematocrit were all low. And that's because he's obviously losing blood. So those labs are going to be normally low if you're losing blood. And then, you know, he has his chloride that's high. And I'm thinking that's because he does have chronic kidney disease. So I'm thinking that's what it could be. So that's kind of what we're doing. So we're kind of trying to figure out why these labs are abnormal and how it relates back to their nursing diagnosis or their medical diagnosis. This is everything that we have to do. And then on top of this, we actually have to write down, we have to do like a full concept map. So what the concept map is, it's literally like a huge diagram, and you have to write down all this information, and you literally just have to tie it into their, so you know, why are some of their labs high? You know, why do we see some physical symptoms? Why do we see some mental, you know, symptoms? And why is everything the way that it is, and how that relates to the diagnosis that they have. So that's what I'm gonna go work on. As whether you're not in nursing school or you're in nursing school, I think it's kind of cool to see what you're gonna do or what other people do and how it kind of differs to what your school does. Like, I like looking at nursing videos and seeing what other schools do compared to, you know, what we do. But yeah, so that's what I'm gonna work on today.
Hey guys, so I'm back home from school now, and I'm working on my concept map. So I kind of explained to you guys the gist, and I kind of showed you guys the paperwork of the concept map, but I kind of wanted to show you while I was in class, I was filling in some stuff. So I wanted to show you guys so you can see what it actually looks like on paper and stuff, and how we actually do it and how much it really is. I can show you when I'm done completely. I probably won't be done for a couple days and stuff, but if you guys want to see my concept map, if you guys want to see a finished concept map, I could also show you that either in another video. We could talk about that some other time, but this is just going to be for today and what I have done for today. I'm still working on it today, but just kind of wanted to show you guys what it looks like all together. So I was just working on my concept map today because I just want to get this out of the way. Hopefully it'll be done by tomorrow afternoon. Definitely tomorrow though, I want to have it done, but I just wanted to show you guys what it kind of looks like all together. So I'll go ahead and show you guys what it looks like. Okay guys, so this is the first page of my concept map. So this is basically the concept map. So what we're gonna have here is we're gonna have the chief complaint. So the chief complaint is gonna be what the patient comes in for. So obviously when they come in, usually they'll come into the ED, or they'll come into like their regular HCP, their healthcare provider, and they'll come in complaining of certain things. So this is what my patient came in for. He came in for specifically dizziness and for generalized weakness, and he had a complaint. He complained of an episode of hemoptysis. I don't really know how to say that, but basically vomiting blood. So that's what he came in for. And then I'm gonna go ahead and put my labs and my diagnostics right here. So these is gonna be, obviously I haven't finished it yet, but this is where I'm gonna put my labs related to my, my patient's problem. So what you're gonna put in here is gonna be what you're gonna be focusing on and what you wanna connect together. So the two that I'm gonna do is, I don't know if I'm gonna change this yet. This is kind of just a placeholder right now because these were two of his main problems. But he had he came in for upper GI bleed and chronic kidney disease, stage 3. And then compared, you know, to all of these is what we're gonna connect clinical findings. So what did I assess on him? Patho for the medical diagnosis. What am I? Blah, blah, blah. This is all for the medical diagnosis. And then you're gonna have to write down, you know, his history of his current illness. And then down here, you're gonna have to write down his current meds, so what he's taken at the hospital, and then his home meds. And then you're gonna write nursing intervention. So what did we do in the hospital to treat this nursing diagnosis? And it says include RT and AEB because whenever you do a nursing diagnosis, it needs to be like, it needs to be a NANDA approved diagnosis. So NANDA is basically, they come up with specific nursing diagnoses, and all nursing diagnoses come off of that list. And then, so for example, you can do ineffective airway clearance if somebody comes in for pneumonia related to medical diagnosis, or you could do related to pneumonia, and then AEB is as evidenced by shortness of breath, coughing, you know, his O2 is 82, blah, blah, blah. And that's where you kind of explain the top 3 nursing diagnoses. So this is where you kind of start prioritizing what's more important related to this. So this is the concept map, okay? So that's the main part of it. But in addition to this is where we start looking at our labs and significance. So this is what he has. So I highlighted the highs and the lows just so I can make them stand out, and then I can go in and look, why are these low? Why are these high? And then of course these normal ones I'm just gonna leave as normal. And then once you pull these out, this is where you're gonna relate it back over here to your labs and do your diagnostics. And then once you're finished with all this information, you're actually gonna highlight upper GI bleed in one color, and you're gonna highlight chronic kidney disease in another color, and then you're gonna go in and look at every single thing that is wrong with this patient, and you're literally gonna color everything that's related to his upper GI bleed. So his labs, his hematocrit is probably low, hemoglobin is gonna be low, so all those I'm gonna highlight the same color as the upper GI bleed. And then you're gonna come over here and put any clinical findings. So he had hyperactive bowel sounds, so I'll put that over here, and I'll also highlight that in the same color as the upper GI bleed because all that relates back to this. So that's kind of how we do it. So I just wanted to show you guys what it looked like. So I haven't done this yet, but this is where you're seeing your diagnostic procedures, the test results, and why they took those results. And then here's where you're gonna put the meds that they're taking. So I haven't finished it yet, but I do have all the names of the meds that he's taking. So what I'm gonna need to do is obviously all these things, which I've kind of already explained to you guys while we were in the car. And then this is where you're gonna start breaking down his nursing diagnosis. This is where you're gonna put all their cues, so everything that you found on him. That includes vital signs, that includes anything that is related to his illness, and then you're gonna cluster them together, and then related to these clusters right here, that's where you're gonna come up with what's the priority out of all these cues, what's the priority, and that's where you'll come up with your nursing diagnosis. And then once you come up with your diagnosis, that's where you come in and you split them into two. I think there's 3 sheets on here, but we only need to do 2. And that's when you're gonna go in and you're gonna write down the nursing diagnosis, which is what I told you. It's gonna be blah, 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 related to blah, 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 as evidenced by, and then the evidence that you have. And then this is where you're gonna need to start coming up with goals, interventions, rationales, and evaluations and stuff. So I haven't done that yet, but yeah, like I said, there's 3 on here, but it's only required to do 2. And then this is where the head to toe comes in. It's right here related to his eyes and all that. And then I've just highlighted everything that is related. So, you know, you're gonna look at their skin color, you're gonna look at moisture, you're gonna look at their GI, GU, do they have IV access, which they do. And yeah, so this is everything that it looks like. Here's where you're gonna do your hourly rounding, your vital signs. So the vital signs that you took for the patient throughout the entire shift. Here is where you write down your hourly rounding. So obviously we're checking up on our patient at least once an hour, just like nurses do. And you're gonna be asking, you know, you're gonna be assessing pain. What position is he in? Has he gone to the bathroom? Has he voided or had a bowel movement? Yes, no, and then you wanna write down how much. And then like well, you don't always need to write down how much because sometimes they do it in the toilet, they're ambulatory. But my patient used a urinal, so I did count how many milliliters he did void. And then making sure that their personal items, this isn't really as important, but this is very important. Includes the safety. So is his bed in the lowest position, call light near? Is he wearing his non-slip socks? You know, all that. That's what you're gonna include there. And then this is the rest. So his diet type, and then this is where you're gonna start to put in and outs. So intake and output, this is where you're gonna put that, which I haven't done that just yet. And then Braden score related to pressure ulcers. So this is where you're kind of gonna rate your patient. So as you can see here, the first thing is gonna be sensory perception. So ability to respond meaningfully related to discomfort. And I put for him, he's slightly limited. And then this is kind of where you're gonna assess him. And then at the end, you're gonna get a total score. And then you can relate that back to everything that he has. And then this is gonna be his fall risk. So history of falling, does he have a secondary diagnosis, ambulatory, is he ambulatory, or if he's not, you know, what does he use, blah, blah, blah. You're gonna come up with a score, and that's gonna tell you what risk is yet to have a fall. So this is where I'm gonna put my documentation, which I haven't done yet. And the therapeutic communication form, which I haven't done yet either, but that's it. So yeah, if you guys do want a more in-depth video on this, which I think that I was able to sum it up pretty quickly, I was talking kind of fast. But if you guys do want to see like a completed concept map or any of my care plans, I have saved a lot of them from first semester, and then obviously I'm going to save this one too, but I can always show you guys how I do that. But yeah, so this is everything. I just kind of wanted to show you guys what it looked like up on the computer and what some of the, you know, what we do and all that. So yeah, that's all I got for you. Okay guys, so that's all that I have for you today. I hope you guys enjoyed this day in my life. If you did, please give it a thumbs up and comment if you have any requests. If you guys have any questions and all, I would love to answer them for you guys. But thank you guys so much for watching, and I'll see you guys in the next video. Bye.